Okay. Good evening, everybody. It is Fertility Solutions, and we are doing our Fertility Talk this evening. And welcome. Thank you for everybody that's going to be joining us or getting the notification now. First of all, I want to say it is PCOS Awareness Month. So I just got a notification on my phone to say that last year, exactly on this day, I was wearing the same earrings, also blue top, to recognizing PCOS. So we obviously through the month, we're going to do a lot of talks. There's also a big competition when it comes to PCOS. I think one of our pharmaceutical companies are going to be offering some great prizes for those that are dealing with PCOS. So let's get into tonight's fertility talk. And we have Barth from Barth Tambwe, and he's from Repro Lab, and it's Repro Lab and Family Matters as well. Am I correct?
Yeah, that's correct.
Thank you very much. Yeah, thank you very much for joining us. So tonight's topic is using donor eggs and donor sperm. So there's a lot of reasons why couples would be told or suggested to use donor egg and donor sperm. And it's always, I think it's a very touchy subject because I think people don't really understand what it entails and why a doctor would recommend. So that would actually be my first question to you. But before we get into that, I'd like to welcome you and thank you for being here and spending your time, taking the time out to actually do this talk with us. So please introduce yourself to the audience and tell us who you are and where you're from.
Okay, thank you for the opportunity, Lian. My name is Barth Tambwe. I'm an embryologist and I'm owner of Repro Lab, and I work in conjunction with Family Matters to run the IVF lab, which is based here in St. That's hospital.
Okay. Tell me, so we'll get into our first question is, when would you recommend donor eggs? When would your doctor recommend using donor egg and sperm?
Okay, as you said in the introduction, this is quite a touchy subject, but after consultation and the tests are being done, the doctor will come to a point where it's proven that the couple or the lady or the woman is not producing eggs at all. Eggs, that's what we call in the scientific word is oocyte, but here we're going to keep the word eggs so that we can allow our viewers and whoever who's following us to be able to grasp what we are busy talking about. Another case is where, for example, we have eggs, but they are of poor quality. The eggs need to go through maturation. It needs to be fertilized. It needs to grow into an embryo, which is viable embryo, which needs to be transferred to the uterus and produce a pregnancy. In case these elements of development are not happening as they should, and this leads to a point where the couple is not going to be able to get a successful pregnancy, the doctor can recommend a couple to use egg donor. On the male side as well, we have case of azoospermia, for example, where sperm is not being produced, or sperm is produced but in a very small quantity or a lot of abnormalities, a lot of deficiencies in the sperm. If we have, for example, testicular failure, in those cases, when the doctor found out that this is not going to lead to successful treatment, they can suggest that the patient consider using donor eggs and donor sperm, whatever the case may be.
Okay. What is the process when using donor egg or donor sperm?
Okay, the process is quite a lengthy one, and the couple or patient will need to be a little bit patient. So the first thing to do is, once the doctor recommends, it's up to the couple to agree to go through the process or no. But as soon as the couple agree to the process, they need to make sure they have their finance in order, because the process costs quite a lot of money. And once they finance in order, they can approach the clinic or any egg donor agency database where they can select. They have to put their requirement or what they need into a donor, a sperm donor or an egg donor, so that they can get a suitable candidate. Once a suitable candidate is reserved for them, this candidate will be referred for psychological test to check that emotionally and as personality, the person is aware, is normal, and is aware and he understands what he is about to do. And then from there, the patient will go and sign a contract with the treating clinic. The donor who is selected also will go to the same center to sign also his contract. Then it will be a blood checkup to make sure there is no communicable diseases, to make sure the donor that is being selected is mentally stable, to make sure the donor is fertile as well. As soon as all these work are done, now it will be time to wait for treatment. When the donor is ready for treatment, when she starts her period, then the donor will be given medication. And in the meantime, the recipient mother will be also on treatment. If, for example, it will be a frozen egg cycle, the two need to be synchronized, then they can work on the side the egg donor, and then the recipient will be worked out on her own side. But if it's a fresh transfer, whereby the eggs want to be frozen, the two need to be synchronized so that once we get the eggs, we can culture them, we can fertilize them, culture them further, and straight transfer them to the womb or uterus of the recipient lady.
Okay. So all donors, they are screened before they donate?
Yeah, definitely. That is a must to be done because remember, we are health facility and we have to make sure what whoever is used for egg donation for sperm donation doesn't transmit the disease, for example, from them to the recipient couple. So we make sure the person is screened, making sure there is no communicable disease. And this screening helps to protect the future mother or the new offspring, even to protect the donor themselves. We go psychological tests to make sure the mental and the personality is okay. We're going to check blood to make sure there is no communicable diseases. And we're going to, on the men's side, we're going also to do semen analysis to make sure the quality of the sperm that we're going to be donated is of good quality. And once it's cleared, then they can be used for the process. But everything needs to be screened.
Okay. Tell me, are you able, if I were to choose a donor, would I be able to choose the physical attributes of that donor, or the sperm donor, or the egg donor?
Okay, yeah, no, there is a possibility because you have your criteria as a recipient. What we see in our clinics is the lady will want to go for a donor, an egg donor that have her features in terms of the skin color, in terms of the body size, in terms of the height. So the parameters that will be available to be like the race, the age of the donor, the interest, the education also. A lot of donor, a lot of recipients are really putting emphasis on education. So it's up to them, whatever the criteria they want the donor to fulfill. And if meets that criteria, then they will be selected. But one problem we need to mention here is if you have a lot of criteria, then the number of potential donors also will go down because it will be quite tough to meet a donor which will be able to give you 100% what you want. But if we can reach 50-60% of what is needed as criteria for selection, we'll encourage such a recipient to go for the donor. Yes.
Yeah. I think it's important to also let couples out there know that donors are not just anyone that is brought up from the street and say, yeah, come on, donate, here's some money for you, and off you go. There's this huge process involved. I mean, even checking the education level of somebody, it's all the as you mentioned, all the tests that they actually have to go through, even psychological evaluation of the donors. So you're never getting just anyone's any donor eggs or anyone's sperm. So that's, I think it's very important to, emphasize that for our
And
listeners.
yeah, Leah, if I can add also, the screening doesn't just stop at the level of the donor or the candidate who's going to donate. We even go back to the family, the parent, the brothers, just to scrutinize of the family in terms of their health, and that also the suitability of the donor. So it's something that we are taking very seriously. We don't do shortcut, because all the documents need to be worked out and available when they are required. So we're making sure that the person that we bring forward as a donor, let it be egg donor or sperm donor, that they meet the criteria.
Okay.
So, yeah, we have also a case where the patient themselves, they have the non-donors. These are the people, family member or friend that they to us and suggest we can use the gamete for the treatment. We can do that as well. And at that level, the screening we're not going to be as deep as possible, because this is something that is being suggested by the commissioning couple themselves.
Okay. Could you tell me about the quality of the donor sperm that you work with?
Okay. First, the donor needs to be it need to be between 20 and 39 years old. The younger, the better. And then they will come in for a semen analysis after 3 days of abstinence, for example. We're going to check them twice. We check things like how many sperm they produce per milliliter, how many sperm are moving, for how long are they moving, and the shape of the sperm, which we call morphology. So a sperm donor is somebody who is not just that average fertility. It must be a high not fertility, maybe above 100 million sperm with 60 to 70% moving sperm. And the morphology needs to be also normal. And this person needs to be of good health. So it must be free of any STDs and no drug use, no smokers. And we screen them randomly from time to time just to check that there is no unwanted element in the blood, which will discard them. It will stop them from, will take them out of the program, definitely.
Okay. Does my chances of conceiving increase when using donor egg or donor sperm?
Wow, that is a good question. Yeah, we know that as women get older, the number, quality of sperm, the number and the quality of eggs goes down, decreases.
Yeah.
So when somebody or a woman is about 35 years or younger, they have about 40% of chance of having a baby. But as they reach the 40s, around 42, these chances of getting pregnant get very low, almost 10 times lower. So the percentage become between 4 and 5% of falling pregnant.
Okay.
So once they use donor eggs or donor sperm, let's talk about donor eggs. We go for the donors that are between 21 to 30 years old. The fertility is quite high at that time, and it's been shown that no matter how old, if the woman is within a childbearing age, the chances of falling pregnant using egg donors goes up to almost 50%. So definitely using donor is quite a good technique or way for somebody to,
Okay. I've got a question that I haven't actually put on the list. If anyone is interested in actually becoming a donor, because yes, we are speaking to couples out there that is looking to actually use donor eggs or donor sperm, and especially with men that are dealing with, and I think it's more and more men are actually dealing with, not having good enough sperm. And they are having to use donor sperm. If there are anyone out there that would like to donate sperm or donate eggs, can they contact you? What is the process? Where do they start?
Okay, we have a website where there is a page where potential donor can go and fill up their details. We have a few screening questions that they need to complete, and then we're gonna receive those questionnaire on our side. If they pass, then we'll bring them closer. We're going to give them a long questionnaire just to check their background, to check their families. And if all that is passed, then they will come in for sperm analysis just to check the quality of the sperm. If the sperm is of good quality, then we'll go to check also their blood as well. And if they pass this, then they will qualify to be donors.
Okay, awesome.
Yeah.
Tell me, do you have any other anything else that you want to add to this?
Okay. Yeah. For sperm donor, the process is quite easy because usually we have sperm in advance, it's frozen and it's kept. So when the recipient couple approach us, we just give our database, they will go through and they check whatever much they need. Okay. But when it comes to egg donor, it's the recipient couple has two choices. Either they can use frozen donors, these are frozen eggs, sorry, and these are eggs that are available already, okay? Or they go and use the fresh donor. Now here, the process, as I previously said, become a bit longer, but the good side of working with fresh eggs is all the eggs that will be produced, they will be for the concerned couple, unless maybe there was agreement that they will be sharing, maybe because the cost is high, they can't afford, and they will be two couples who will be sharing, then that can be done as well.
Okay, so normally it's one donor per couple, so it's not going to be like there's 5 couples out there with the same, let's use the same donor eggs.
No, one donor will go for one couple, but when the eggs are frozen, depending from one clinic to the other, we can have a batch of 6 to 10 eggs that are put together. So whenever a couple approach us and they need a frozen egg donor, then we can give them from 6 up to 10 eggs. But if the fresh from a fresh treatment cycle, then everything that is produced from that cycle they paid for belong to them, unless there is an agreement. Maybe they came in too and they want to share the cost. That can be done as well. Yeah.
Wow, you've answered some really great questions there. And I know some of them weren't on my list, but it was quite interesting. So I had to ask some of those questions. So thank you very much, Barth, for joining us this evening and doing this talk with us. And like I said, there are a lot more, I think there's lots more couples dealing with infertility and also having to go the route of using donor eggs and donor sperm. And I think there is very, very little knowledge out there or being spoken about this in the process and stuff. So it's very important for us to have this conversation. If you have any closing words, please let me know. If anything you want to say to the ladies and couples out there?
Yeah, we asking our ladies and the men, couples out there to not lose hope. With advanced fertility treatments, we can do quite a lot with our knowledge. So whenever there is a problem, please feel free to approach any clinic that is close by and ask for advice. As we have discussed here, donation, it's something that is working already, and we have a lot of couples who could not fall pregnant before, but because of this technique of using donor eggs or donor sperm, we have a lot of families that are completed and they are very happy.
Okay, that's awesome. And I know you guys are working a lot with male infertility. You know, that's quite a big focus for you. So I just want to mention that. And where are you based? If you can just mention that.
Okay, we are based at in Centurio at Unitas Hospital. And the place we are running our business is in Family Matters Fertility Clinic.
Okay, awesome.
Yes.
Okay. I think at the end of the talk, what I'll do, or maybe Porto will just add your contact details at the bottom in the comment section. So anyone that wants to get contact with Barth, and especially those dealing with male infertility matters, please contact Barth. I think he is definitely the guy you want to speak to in terms of that, and when it comes to using donor eggs, donor sperm. So thank you very much for taking the time out to do this talk with us, another fertility talk with us, and we hope to have you back soon again on Instagram. And yeah, have a great evening. Thanks, Barth.
Thank you, Leanne. Thank you for having me. And thank you to our viewers.
Thank you very much. Have a good evening, Barth. Thanks.
You too.
Bye.